Good morning, everyone. You're watching Atlanta and Company. I'm Christine Pilara. Many have questions and concerns when it comes to their reproductive health. Did you know right here in Georgia, there's a facility that has all the answers you need? Reproductive Biology Associates was established back in 1983 as Georgia's first IVF treatment center, and it specializes in helping bring new life into this world. Joining me this morning is Dr. Dorothy Mitchell-Leef to tell us more. Thank you. Welcome back.
Thank you. Glad to be back.
Well, let's dive right in. For women out there who might be listening who have had tubal ligation or tubal disease, what options are there to achieve pregnancy for them?
Well, today we used to, in the past, be able to reanastomose tubes, but we found that that was not as effective. So now we have in vitro fertilization, which gives patients so much higher rates and excellent success rates. It depends on if you had your tubes tied. You wouldn't have to worry about doing anything else. If you happen to have something called hydrosalpinx, where your tube is closed, it tends to be that we need to remove those tubes first and then do in vitro. But the success rates can be very high depending on the patient's situation and age.
Oh, that's great. And what about a history of previous pelvic surgery? Possibly, would that cause infertility problems, maybe even a ruptured appendix?
Yes, we really like to talk to patients about making sure they get something called a hysterosalpingogram, which is a dye test. It's an x-ray that it lets us know whether or not the tubes are open. And many times patients might have a ruptured appendix that could cause adhesions, scar tissue, and even close their tubes. And
what about age? Because I know a lot of people, it seems like, are having children later. My first child I had at 39. So how much does age factor into infertility? What are you seeing, or what have you seen?
It's a lot. Our average age of our patients is almost 38 years old. We really try very hard to work quickly with those patients who are older because they have a decrease in the amount of eggs they may have, and we get something called AMH levels, anti-Mullerian hormone levels, which actually help us know where they stand and be able to move quickly if their numbers are declining.
And I've learned the quality of the eggs is what they were telling me too as you get older. That you have to worry about that as well.
Yes, because they don't divide properly, and so you have more genetic problems, and therefore you don't have the chances of getting pregnant as easily because many times the eggs don't divide and give you a good embryo.
And let's talk about IVF, because a lot of people, they have concerns that if they do IVF, oh my gosh, am I going to have triplets? So is that still?
No.
Okay. You're well more advanced than that now, right?
We have really done a very good job of improving our outcomes. And right now we try very hard, especially in women that might be 35 to 37 or younger, only put one embryo in because we feel the quality is excellent. And then we have different methodologies to either be able to freeze eggs in the future, so they could, if they have a large number of eggs, we'll fertilize some of the eggs and freeze the rest. So those patients have those for the future as well. So we have a lot of good options. We can also do complete genetic hybridization, which is something where we can biopsy the embryos and be able to know the genetic abnormalities and only put the normal ones back, which allows you to just put one back, which in the past we used to put 4 back, 3 back, because we knew only one would take. But this way we know which one we're putting back, and that's normal.
Phenomenal. Unbelievable how far we've come, honestly. If both, let's say, the woman and the man have been sterilized, can they still have a pregnancy?
Yes, absolutely. Wow. We still do in vitro, but the husband can see the urologist, who actually can just directly remove the sperm from the testes and just do IVF with something called ICSI, intracytoplasmic sperm injection, and therefore neither of them would have to have surgery or at least a repair. They can just do in vitro, and they're very successful.
Wow, that's phenomenal. And congratulations. She was telling me in the commercial break, 30 years. And tell our viewers how many babies.
30,000 babies.
Isn't that incredible? And for so many parents, so many people out there that didn't think that they would have the opportunity to have a family. It's so wonderful. So congratulations.
Thank you. And
it's great.
We're looking forward to our party.
All right, good. And if you would like more information about Reproductive Biology Associates, please pick up the phone now. Give them a call. It's 404-257-1900. Or look on their website. It's rba-online.com. rba-online.com. And this segment was paid for by Reproductive Biology Associates.